So today I chose to talk about mental health and student athletes. I have a lot of background in working with mental health, considering I'm a mental health technician and currently an assessment worker, which pretty much means that when people present to the emergency department, I'm in charge of their care. So I am the person who talks to them and figures out what's going on, what brought them in, what's their symptoms. And then I talk to a psychiatrist, and the psychiatrist gives me information on what I should do with this patient. The interview is anywhere from it can be as little as 5 minutes to over an hour, talking to the individual who is presenting and seeing what's going on. However, when you present in a situation like that, you don't talk to a psychiatrist or psychologist. You're only talking to me, and then I talk to the psychiatrist and the psychologist, and then we figure out what we can do and if you need inpatient stays or what resources we can give you. This is really important to me because I was a student athlete. I no longer am due to medical conditions, but I was an athlete all my life, a 5 sport varsity athlete in high school. I did 2 sports in college, possibly 3 until I wasn't cleared. So I swam in college and I also ran cross country. And then I almost was on the cheerleading team as well. But I did conditioning and everything for all these sports. I did tryouts for all these sports. I was with these coaches for all of these sports. The pressure on student athletes, you have practice daily, even twice a day or 3 times a day in certain sports. I mean, in swimming, we were up at 4 a.m. doing practice before classes, going to class all day, and then going back to practice later in the day. We had competitions, and even some of our travel was up to 4 or 5 hours away, which was completely unmanageable to do sports and go to school. Student athletes have to have a full course load. You can't be a partial student in school. You can't do less than 12 credits and be a student athlete. And you also have to maintain a certain GPA. It depends on different schools and what part of like the NCAA you're in, if you're Division 1, 2, or 3, what the GPA requirements are. But you have to maintain a certain GPA. Student athletes also have strength and conditioning practices and programs that they have to be in. They have rehab that they have to go through. Not everybody, but there's different things. And then how are you supposed to manage a social life and relationships on top of that? Are you able to do that? Are you able to maintain all these things? Which is one of the issues in mental health and student athletes. How are you expecting an 18 to 21 or 22-year-old to maintain these things? There's a lot of stigmas that go with mental health issues. So, you think that a student athlete is strong, stable, and tough from their sport, but that doesn't mean that individual is like that. What resources are we giving student athletes for mental health? We're giving them athletic trainers, and we're giving them in-house physicians and dietitians and sports nutritionists, and you're having these full-time people on staff, but who are they supposed to talk to about things that are going on? Student athletes have family issues, they have money issues, they have school issues. What if you're struggling in school, or you have a grandma pass away, or you have all these things that are going on? How are you able to maintain these things? For me personally, when I was at Westminster and I was a student athlete, I had a full course load on accelerated track for going to school for sports or for medicine. I wanted to be a doctor, sports oncologist, but you can't do that. I couldn't maintain my course load on top of being a student athlete and on top of having medical things that were going on and on top of having family issues that were going on. I had 3 grandparents pass away in my freshman year of college. Who was I supposed to talk to about these things? Who's going to understand these things? When you look into psychology and psychiatrists, which there's psychologists can't prescribe medication, psychiatrists can, and the counseling that's provided, there's none, at least in my experiences. I was not provided any counseling that was specific to sport athletes. I was provided counseling for someone who's grieving, someone who's going through medical issues. not someone who has 6 classes, is participating in sports and trying to maintain the sports because my athletic scholarships are required for me to participate, and now I'm worried about money, and now I'm worried about other things. Sports psychologists should be a thing. They should have a background in physical education, and they should have a background in different things that relate to sports, whether it's sports medicine or you are a coaching minor or whatever. There should be things. Clinical counseling, like I said, focuses on one thing at a time or multiple things, but they don't understand the things that are coming with it. How are these people supposed to understand if they've never been through it or they don't understand what's going on? Mental health providers don't understand the environment as well. So even I see very young people presenting to the ER with so much going on, student athletes who are coming in, and they just want something to fix it. They want something to help their anxiety, or they want something that's a quick fix, and that's not really a solution. But what are your stressors? What is a stressor for a student athlete compared to a normal student? What are the motivations of a student athlete? For me, I was a motivated student athlete because I needed that sports scholarship to continue being in that college. I needed that to pay my bills. What are the dynamics of being a sport athlete? I highly relied on my team the whole time I was in school. For me, if I did not have that team, I wouldn't be where I am today. I know I covered a lot really quick, and I gave a lot of personal pieces to this information, but I think that there needs to be a change, and that should happen sometime soon in sports for students. I think that there needs to be different resources for mental health and student athletes. I think that this is a hard topic to cover, and not a lot of people are open to talking about things that are happening in their lives like I am currently. But you need to think of these athletes as human beings and not just athletes, and as students, not just athletes. People think that because you're an athlete, that's it. Who cares about the rest? I hope that this presentation helps you understand the things that athletes go through, and brings the importance of mental health and student athletes to individuals.